We're asking, is immunotherapy finding its way into colorectal cancer? And here to tell us a little bit more about this is Professor Julien Taïeb from Paris. Thank you for joining us. So we're talking about the CheckMate 142 trial, the last part of it. What do you think about the results of that?
So once again, we have very good results with immunotherapy and microsatellite unstable colon cancer. These microsatellite unstable patients represent approximately 5% of all the metastatic setting of colon cancer patients. It's more frequent in non-metastatic disease. However, this is a first-line trial. For the first time, we can see what immunotherapy does upfront before any other treatment use, and the results are very good, especially overall survival and progression-free survival medians are not reached. So we need more follow-up to see how it will go, but it's possible that, like in melanoma, some of the patients will be almost cured by a medical treatment in the metastatic setting, which is completely new.
And generally, what are the challenges of using immunotherapy in colorectal cancer?
So the problem today is that 95% of the patients are not microsatellite unstable. They are called MSS, and these MSS patients today are not responsive to immunotherapy. So we tried by diverse way, adding new molecules, trying to stimulate immunity, to make this cold tumor hot and to make immunotherapy a success, but this was until now a failure.
And if we think about how our understanding of tumor biology has improved, what has happened there?
So I would say that in this meeting what has been done is a high educational session on the better understanding we have today of tumor biology for colon cancer, but more in the early stage of the disease, non-metastatic disease. And we have now a lot of prognostic factor that we will have in the future to integrate to make nomograms and scores using probably artificial intelligence or deep learning strategies.
So I suppose it is valuable to know that the immunotherapy only works for this 5%. It's useful to know where it won't work.
Yeah, today of course we have the very good group, but 5% of the other group will double the population eligible for immunotherapy. So we are still looking of a subgroup in the MSS large group that will respond in the future to immunotherapy.
I was going to say, where is research going to go next in this area?
Probably to try to other ways to make this cold tumor hot by using maybe radiotherapy, which may lead to an abscopal effect, destroying all the disease everywhere from a target lesion that has been submitted to radiation therapy. Also subtypes, molecular subtypes, specific subtypes of colon cancer, which are not MSI but maybe immunoreactive, are also tested in clinical trials currently, and we will see the results next year.
Great. Well, Professor Taïeb, thank you very much.
Thank you.